Hi, everyone. Thanks for joining us tonight for a presentation with UC San Diego Health Sciences and the Rady School of Management. We are here to talk about how a Rady MBA can help you progress in your career and utilize different skills that you may not. Before we get started, I have some basic, housekeeping items. First, I'm going to introduce myself. My name is Christina Cook. I'm an Associate Director of Graduate Admissions here, and I do mostly advising for the Flex Executive Weekend Program, but I have worked in the evening program and can answer questions for both. This presentation is basically for our Flex programs. It's going to last about 45 minutes. Sometimes if you'd like to stay over, we're certainly willing to stay and answer your questions. And should you have questions, which we hope you do, feel free to present them in the chat as we go along, or you can save them at the end for Q&A. It's totally up to you, whatever you feel comfortable. So starting with some introductions, we have a very full house today. First, I'm going to introduce John Massiana. He is our Assistant Dean here at Graduate Programs. He will be talking to you a little bit later just about our curriculum and really how our program can directly affect what you're doing in your jobs. Now, we have Matt Alex. He is the Director of Graduate Admissions of all of our 7 graduate programs here. Audrey Phillips, she is our new Director of all MBA programs. Thank you so much for being here, Audrey. You met myself, and then we have Mai Hong. She is going to be available to answer any questions you may have about the fellowship attribute in terms of the leadership component at UCSD Health Sciences. So there we go. That's a lot. So agenda today, just so you know, we're going to talk a little bit about the STEM designation, how we see business education. We're going to overview sort of the basics of the MBA program. We're going to talk about the curriculum and the format, run through admission requirements and sort of process. And then finally, we'll address the financing component and, of course, question and answers at any time. So let's get started. So before I delve into a lot of other things, it's important to note that the Rady MBA program is Flex designated. All of our graduate programs are, Flex, STEM designated. It's been a long day. And they all are, and it was actually relatively easy for our programs to obtain that acknowledgement and that sort of certification because of what UCSD stands for and what we've already been doing all along and how we teach. It's not really about what we teach, but also how we teach and sort of the skills that students take with them. And in order to really gain this designation, the program must have an emphasis in management science, data analysis, forecasting, dynamic modeling, and research techniques. These are all relevant to business. And so on the right-hand part of the slide here, you'll see some of the business practices that have been using these techniques and this style of managing and making decisions for quite some time. So why Rady? I mean, obviously, number one, we're part of this wonderful agreement we have with you, but there's some other great reasons. First, you're going to develop a very strong skill set in the technical side of things. You will become very familiar with data and how it's used in just about every decision, nowadays it's being made in a business setting. You will definitely understand more leadership philosophies and emerging sort of belief systems and how one can best get the most out of your employees and your team as you progress through your career. And then, we at Rady, like yourself, hopefully, we really promote collaboration among students. This is not a program where people are, you're probably all too young, but people used to steal pages out of the books out of the library when I was in school. It's not like that at all. There's a healthy competitiveness amongst the students, but it's collaborative. We believe more minds, that are addressing a problem is most likely going to turn into a better outcome in the end. And you really do have to sort of put yourself out there and work together in order to really make some breakthrough ideas. So finally, we are very happy to have been rated number 4 in learning and entrepreneurship by Bloomberg Business Week MBA rankings. And as far as the learning component, our faculty is basically 100% responsible for that ranking. Not only are they recognized globally and nationally for their research, but they're very dedicated instructors and teachers that really want you to learn, and they want you to understand how to think critically and use data to make the best decisions possible while in the program, in your careers, and ultimately your life. So basics about the MBA program, these are our two flex programs. The they both are, let's start with the similarities. They're both 92 credits. They both require the same core curriculum, and you both have access to the same electives, and we'll talk about that briefly in a moment. The length of time and the pace is really, and the type of student in each class is a little bit different. So the flex evening meets twice a week, every week for that first year. That is your core curriculum year. And then if you continue with that pace, at twice a week for the remainder of the period of time, the 27 months, it takes you about 2.5 years to get through. After the second year, however, you have options to take classes at other times, and I will discuss that briefly. But the Flex Evening program is designed for professionals from 3 years into their career and into quite a bit later. Whereas one of the differences with the Flex Week and Executive program that is designed for individuals with 8+ more years of experience, preferably 10. You meet every other weekend on campus. It's a Saturday and Sunday from basically 8 to 5 with breaks and lunches and sort of things like that. But it is a faster pace because you're taking 3 classes a quarter versus 2 in the evening. And you can, again, as I mentioned before, I'll discuss what you can do in that second year with your electives. But for the most part, the beautiful thing about our programs is that they all are the same. You are getting the same education, you're getting the same professors. And one of the executive program is not a watered down version of others. Finally, if you wanted to get out sooner, you could accelerate both of these programs. It would just require you to take more classes in the second year of your program. So these classes are your core curriculum. And as you can see, these will address basically every functional discipline and area within an organization. They also serve as prerequisites for the electives. The way this works is when you enter your class, you will be with your cohort, and you will take these classes in a lockstep fashion in this very defined sequence. This is not the sequence that you'll be taking the classes. It's just a representation that's nice and colorful. But these are the core classes that you will be taking, and that's kind of the unifying factor of an MBA. Every MBA program is going to have 1 year where you're really addressing the fundamentals of business and how business is done. The second year and how the projects you do, the electives you take, the interactions and the discussions you have with your professors are what kind of define your own degree. You will, of course, get to know your cohort mates very well, especially that first year. You may get to know them too well. But the good thing is we actually put you into groups. So when you do go into these classes and you have group projects, you're not having to select different people each year or each class. And I think the benefit of that is that it is a bit of a support system as well as your group projects. Because not everybody's going to arrive every day on their A game, and there's going to be times in your life where you're not going to be able to be as available mentally, and they'll be there to support you, and likewise you'll be there to support. So the other class that you noted, probably saw on the last slide, that didn't sound like a business functional area, it was the Rady Action Project. And that is basically the capstone course that will take place in the second year for all flex programs. And instead of having it a 3-quarter class where we used to have it as in a slightly different name, we've consolidated into 1 quarter to allow students to focus on their elective portfolio or to incubate a project if they go with the entrepreneurship track. So you have 2 pathways, and you can choose entrepreneurship or industry consultant. These are both project-based courses where you're going to identify and complete like a big project with a self-selected group of classmates. And the difference mainly between the entrepreneurship and the industry component is the entrepreneurship is when you would be bringing your own idea in, you or one of your group members, and you would process that. You go through the steps of due diligence to really determine whether that's a feasible idea and ultimately be able to create a business plan. The industry consultant is you will be serving as a consultant to a company that comes to us with a real business problem. And these are local companies, nationally and global companies do come to us, and our students learned quite a bit in that respect as well. So you have two options, and some of these examples, that we've had in the entrepreneurship. For example, we've had six med tech teams. I'm going to use one example. One was creating a product to use AI to diagnose cancer. And then many MDs have opted to bring in their own idea as a startup, made later on in their life. One of them was a blockchain powder testing service. And I don't really know what that is, but I'm assuming you do. In the business side of things, we've had a number of projects with UCSD Health. We've developed a business idea for Scripps Health and a new business case for Kari Health. And that's actually one of our alumni is present in the CMA. So these are sort of just the basic classes. The Rady Action Project is new, but it will provide the same experience as Lab to Market, but in a slightly condensed format. And the second year of your program, which I was mentioning, is really where you start to choose and make the choices that are right for you. And these are just some of the electives that you can choose from. We've italicized some of the very focused healthcare classes, but all of these classes are relevant to running a business, whether it's your own or a larger department within a company. An MBA basically creates and teaches you very transferable skills. So these are just basically the general idea. I encourage you to look at these and to look at other MBA programs electives, and you will hopefully see that we are geared towards innovation, design, and really pushing the envelope in terms of change management and understanding what's on the forefront, again, using data to make these kinds of decisions. I mentioned this a little bit earlier about how you can structure your degree after the first year. So once you're done with the core curriculum and you're able to sort of break from your cohort if you'd like, and you can take classes, when you want them, more or less. So if you're tired of coming every weekend, you could take a class on Wednesday night and cut out one of the weekend days. If there's a class that you really want and you want it right now, you might have to take it at a different time. It may not be completely convenient for you, but the idea really is for you to get to know other students in the Rady program, be able to grow your network, and also have the flexibility to, work with your own life schedule and work schedules. And John, correct me if I'm wrong, but students entering this year will have the option for some online courses in their second year.
There will be a few.
Okay, great. So that's just another attribute in order to provide some more flexibility for our students. And so I'm going to hand this over to John. I introduced him briefly, but I'm going to let him take it as well and introduce himself more formally.
Well, thank you, Christina. Thank you, Christina. It's great to see all of you here today, and really appreciate our partnership with UCSD Health Sciences. It's really refreshing to have such a strong bond with another very, very strong partner here on campus. I'm John Messin, Assistant Dean of Graduate Programs. I am a Triton grad, so from a long time ago. So UCSD is my home school, so it's great to be back here at UCSD. Been here for about 9 months or so, and it's been a wonderful ride so far, and a great team we have in place, which many of them are here on this call. So you can go ahead and go to the next slide, Christina. I'll share a couple of slides with you. So I wanted to take a bit of a step back with you all here, and did some research earlier about this, and just wanted to sort of preface this by saying, why are you here? Why would you want to pursue an MBA? There are so many different options out there for you. There's an MPH, the Masters of Public Health degree. There's just so many options for you. Now, I understand we do offer a really strong scholarship, so that's probably a big driver here. But I just wanted to share some information with you on just the healthcare industry and the high demand for healthcare managers. You probably are here today looking at the degree from Rady, the MBA degree, as a way to potentially pivot with your career into management and having the best of both worlds, practicing great patient care with the business side of healthcare. So just to let you know, I mean, it's an incredible industry, absolutely incredible. So it is also growing. So just to let you know, I just did some research that the healthcare industry is at 4.3 trillion in terms of expenditures, and is expected to grow to 6.2 trillion in 2028, representing 19.7% of gross domestic product. And the US Bureau of Labor, that's the first point there, shows that the need for medical and health services managers is projected to grow more than 35% from 2020 to 2030. So many jobs that have not even been created yet will be available to you as a healthcare manager in the near future here. There's also 51,800 medical and health services managers needed every year to account for people leaving the field and retiring. And federal government projects 20% increase in healthcare admins by 2026. So a lot of growth in this industry, particularly for healthcare managers, which you could potentially be with your MBA here from Rady. And the median annual wage is $104,000, and the top 10% of earners make $205,000. So really strong career outcomes here from being a healthcare manager. Next slide, Christina. So, but why is an MBA important? Mentioned that the healthcare industry is really growing, but I would say this, why is an MBA important? You really gain the strategic thinking and people leadership skills that are critical for leadership roles in healthcare. And why is that important? I mean, I'll just give you an example. ChatGPT is having a massive impact on us right now here at Rady. We have no idea what to do with it. It's here and it's here to stay, but how are you going to use AI? How are you going to use ChatGPT to help deliver amazing patient care? The education, the MBA education here at Rady, you'll be able to add that lens to UCSD Health Sciences and help your organization pivot towards the future. And adding an MBA to an MD degree is a great way to enhance physicians' marketability as well and allow you to pivot as well and practice more on the business side. With an MBA, you can definitely help look at the operations more efficiently and help ensure that patients have access to quality services. I'll also give you just another example. My wife, who is a UCSD medical school grad, she works at Kaiser, and because of COVID, a lot of patient appointments went to virtual. And it was wonderful flexibility for my wife, who could work from home during COVID, and she's still doing that now. But how do we make this whole process, which is now here to stay? I mean, I love virtual visits with my doctor. I absolutely love it, but it's not going away. But how can we make that more operationally efficient for our physicians? And that's really where your MBA is going to help you as you figure out how to really make things more efficient for your organization and use new technologies in order to create a better patient experience. Next slide, Christina. So the benefits of an MBA for the healthcare professionals, I mean, certainly it goes without saying that learning the business side is an incredibly important part and an incredibly big benefit. And I always like to say that you're a little bit dangerous with an MBA from no matter what background that you have. You're going to be attending meetings. You're going to be attending maybe some finance meetings, marketing meetings, and you're going to know what they're talking about. You're going to be able to contribute to conversations and meetings that you've never been able to before and really have a seat at that table. You'll be able to go through financial statements. You'll be able to understand the marketing plan, to create a strategic plan for UCSD Health Sciences. Maybe you want to innovate a new process or a product for UCSD Health. The MBA is going to help you do that. Plus, the MBA will really give you a rewarding career path. Not only are you going to be able to make more of a positive impact on patient communities and their lives, but you'll be able to contribute to the business side as well. I think that one of the biggest benefits of an MBA is really enhancing your communication skills. Communication skills are huge. When you get into management, you're going to need to effectively articulate your points very, very quickly. And an MBA really gives you a lot of practice to do that. Strategic thinking and people leadership skills are critical for leadership roles in healthcare. And no doubt, with an MBA, you are able to go in a lot of different places. Unlike other degrees that are very narrow, an MBA is very broad. So you can actually pivot your career maybe into another area within UCSD Health. You can pivot into finance, marketing, operations. So, we can go to the next slide, Christina. Actually, this is fine. And just to let you know some top motivations to pursue an MBA. And I actually just pulled this. This is actually not for healthcare professionals, but overall, Graduate Management Admissions Council released a survey of prospective students, and across all industries, they fill out the survey and basically say what their top motivations are: enriching their life and developing potential, increasing income. Of course, there's strong salary income, and we'll get into that in a little bit. And gaining business knowledge. Those are the top three. Most of our students, Christina, correct me if I'm wrong, most of our students, probably about 75% of them, do not have a business background. So If you do not have a business background, you are actually in the majority here at Rady. Absolutely, we welcome students from all walks of life into our MBA programs, as well as our other master's programs as well. It's an opportunity for you to really learn from a lot of individuals and professionals and managers who are different, and you gain a lot of skill sets from that. So it is really a valuable degree in terms of the network that you have in the classroom and the people that you're learning with, particularly our flex students. And just the last point here, really with an MBA, we always like to see our students push the boundaries as far as they can go. I mean, the sky is limitless. You can really pivot your career in a lot of different directions. It gives you a lot of flexibility and allows you to really advance to wherever you want to go, whether you want to be an entrepreneur, want to move into a COO position, et cetera. The MBA really helps you get there. So what can you do with an MBA in healthcare? And these are just some of the positions, and I cannot even begin to tell you what some of these positions are. I don't really know, but a lot of our students go into some of these positions, certainly. And of course, it depends on your individual career goals and interests. But there's health and hospital administrators, clinician leaders. My wife calls them physicians in charge, where she works at Kaiser. Consultants, you could be a consultant recommending ways to improve or optimize day-to-day operations, medical practice manager. And yes, as Christina already mentioned, there's a huge drive as well for entrepreneurship. You can actually be on projects and learn how to bring a product or service into existence and make it viable. Or you can be an entrepreneur at UCSD Health as well. And that's basically an innovative consultant from the inside, innovating from the inside to create a new product or service that's going to help your organization. So we do teach both entrepreneurship as well as entrepreneurship.
There's quite a few individuals that come in, they're moving into management, or they want to move into management, but they also have an idea. And so they really, they're learning the skill set that they want and need, particularly the leadership and the communications skills. But they also have these ideas that they've seen are missing in the healthcare field. And so they will utilize the entrepreneurial component of our program to further define them and understand really if they're viable or not. So it's kind of it's surprising, how many actually come in with these really amazing ideas.
Oh, yeah, we have several students that have come to us. They said, I already have a patent. I just don't know how to bring it to life. So that's another reason as well. If you've got a real strong innovation and you've got a patent or something like that, you want to bring it to market, you want to really capitalize on it, and MBA can really help you with that. So. And then I just wanted to share some numbers with you. We're really proud of our recent graduating classes, our 2022 classes, and we're looking forward to great outcomes for 2023 as well. These are just the average salaries for a few of our programs, including our full-time MBA as well as our Flex MBA and MPAC and MSBA. We're always looking to make sure that our students have strong career outcomes. Now, obviously, all of you are considering the Flex MBA, and so you're coming in with strong work experience and you're working while you get your degree. So you're actually gaining more experience while you get your MBA, which is the best of both worlds. You're getting your degree while you progress in your career, which is fantastic. And that obviously, of course, translates into a strong salary. And so, of course, the range is very wide. Some of our students come in with just a few years of experience. Some of them are very experienced professionals as well as physicians. So it's a wide range, but it's very nice to see a healthy return on investment. Generally speaking, and this is on average, we see about a 25 to 40% increase in salary for our Flex MBA, anywhere in that range. Of course, it depends on what you do and how much experience you're coming into the program. Many of our younger professionals end up accelerating even more with their MBA. When students that have a lot of experience, they may not experience that much of a growth because they've already accelerated quite a bit in their career to date. But it's great to see this. We also just have a bit of information on the payback period, not the payback period, but the salary to debt ratio, which is pretty strong. So if you took the salary, your outgoing salary, and divided it by the tuition that you pay, it generally is about 1 year. Of course, we're not factoring in living expenses and all of that. And obviously here with the UCSD Health Sciences and Rady Scholarship, it will be even more affordable for you. So it'll have an even higher salary to debt ratio. Okay, and then finally, I know we have some time here for some questions. I just wanted to share two interesting quotes from U.S. healthcare recruiters. We love to look at GMAT research. They administer the GMAT exam, and they also provide a lot of research out to business schools. But I just happened to look at this corporate recruiter survey that was released last year, and these two quotes came from healthcare recruiters. I don't know who they are, but they just quoted them in this survey. And the first one said, companies need colleagues who can learn and adapt quickly. MBA students have had to do that in their studies and learn both the hard and soft skills we need to be successful. Those with a STEM focus are even more valuable, which is a great quote. And then the other one is, I work in the provider healthcare space where historically there has been a strong emphasis on bringing in masters in health administration candidates for strategic roles. At least in my organization in the past 10 years, that idea has changed. MHAs have been moved to strictly operational roles, while MBAs are selected for strategic roles. So even in the healthcare space, healthcare recruiters are seeing the MBA as really being beneficial for higher level roles within their organization. We'd love to see that. So again, I don't know who these recruiters are. They didn't say, but it was great to see that information and the validation that an MBA really holds a lot of weight, particularly in this industry, which is growing, and one in which is the envy of a lot of other industries out there. So we're glad that you're pursuing that and staying here at UCSD. So I will turn it back over to Christina to cover admissions.
Myself first. Thank you, John. That was very helpful and useful. And I haven't seen these quotes before. That's pretty powerful in terms of the switch from the MHA to the MBA. But of course, I know that because I have an MBA. Anyway, so yes, let's talk a little bit about the admissions process. So typically the process is relatively easy. The first thing I'll state is that we do not require a GRE or a GMAT. It's optional if you'd like to provide it, but it's certainly not necessary. So the first step, if you're interested, is to meet with me or my colleague Sophia, who's works with the Flex Evening program. I can advise you and give you more information how specifically your situation would apply and what I can do to help you. This following is the sort of the application checklist. We ask for an online application. It's basically asking for demographic information. It's sort of a portal system. We ask for your academic transcripts. So we as a program can make a decision about your candidacy using unofficial copies. There's no problem. We just need to have a set of each. You obviously are highly educated, so we would need to see all of your transcripts. But should you be nominated and admitted into the university, you will need to provide your official transcripts. And we do this, this happens for every graduate student across campus. In addition to the transcripts, we ask for your CV or your resume and 2 recommendations. And these are not free form letters that your recommenders need to write. What would happen is in that online application portal, you would submit your recommender's name and contact information. They are sent an email immediately, which will take them into your portal, and they are asked direct questions about you. So I say this because it's often helpful to let them know that in advance when you ask, because in my experience, if they believe it's a very time-consuming process, and of course they want to do a good job, they'll probably wait. And that's the one area of your application you have no control over. So that's what I would do, is just let them know it's, half hour, 40-minute time commitment, and they're not kind of free-forming writing something from scratch. In addition to the recommendations, we ask for essays and then some short answer essays which are embedded into the application. The uploadable essays are more of along the lines of your personal statement, why us, and then we ask you to align yourself and tell us more about yourself in relation to some of the most important aspects of what Rady is, and that is data-driven, community involvement, and lasting impact. Finally, again, the no GMAT, the GRE, what would happen is once your application is complete, we will review it. We will make a decision whether to interview you. If so, we schedule an interview. After the interview, it's relatively, you're done for the most part. We would make a decision shortly thereafter that and let you know of our decision and steps to move forward. The application deadlines to enroll for the fall of 2023, the first one coming up is June 1st, and the last one is July 15th. With that said, we will review all applications when they are complete. So even if you got it in any time, once it's complete, it's really more of a rolling basis. So that's the basic process. And then the financing options, obviously, you're going to hear a little bit about applying for support through UCSD Health Sciences. Hopefully you'll learn about the departmental support and the Rady Fellowship that goes along with that. But yeah, I'm going to let Mai talk about that.
Hi, everyone. My name is Mai from the Health Science Office of Faculty Affairs. Thank you so much for having me. I manage the Health Science Faculty Leadership Skills Training Fund. I know that's a mouthful, but we're very happy to support mid to senior level faculty who are interested in pursuing the Rady MBA program. If accepted into the Rady MBA program and approved for the Health Science Leadership Training Fund by our selection committee, which is comprised of high-level leadership in health sciences, faculty participants will receive program tuition support and is expected to pay 1/6 to 1/3 of the costs. And the remainder will be supported by the Rady School of Management, the department, and the Vice Chancellor of Health Sciences. So our website provides further details on how you can apply for our training fund. Christina mentioned that the upcoming deadline is June 1st. We really highly recommend that you apply in May to assure a timely review. So I will place our website and emails in the chat. If you would like a one-on-one consultation with one of our staff members, please reach out via email. And so a lot of great information on our website and all the details of the training fund. Thank you.
Thank you very much, Mai. So I'm going to go ahead and just move it to straight, question and answers at this time. So please feel free to ask any question you have about our program, about the process, about the funding. We'd be more than happy to answer. And I need to expand my, I'm unable, unfortunately, Matt, you might have to help me here. I'm unable to see the full gallery.
Say that again.
I am unable to see if anyone is asking questions or raising their hand. My gallery is not opening.
I'm keeping an eye out. We don't have any questions in the chat right now, folks, but feel free to drop them in there, or you're welcome to come off mute and ask questions for the whole group as well.
Very exciting that we have that scholarship program. And thanks for going over that, Maya. It's fantastic. So yeah, feel free to ask any questions you have about the experience or what to expect or how we run the MBA program here at Rady. Feel free to fire away anything that we can help you with. Thank you again for coming tonight.
Well, I do want to emphasize, just out of pure making life easy for yourself, if you are interested in this, I would definitely shoot for the June 1st deadline versus the July one. In addition to just the funding reasons, your transition into the program will be much smoother the sooner you can move forward and we can start onboarding.
And it looks
Seppi.
Yeah.
Hi, Dr. Kulani.
Hi, thank you for your presentation. Again, about the finances, that's going to be a limiting factor. So how would I know what the tuition would be if I have no departmental support? Or is it a different application process if you don't have departmental support?
I think you need to apply, and then we supply that information, Maya, on your end, so that you can make the decision on your end on the funding from the UCSD Health Sciences. Is that how the process works?
Oh, so let's assume I have no funding at all from the department or health sciences. Let's say I'm a doctor in the community and not a UCSD doctor, because I think that might be the worst case scenario where you have absolutely no funding. Assuming that you would get admitted, or is there is there a process by which you can get admitted as a student, as a California student, basically, who wants to get an MBA?
Yeah, I can jump in and take that. Great question. So it would be the same application process. All of our applicants do go through the same process. Also, all of our applicants who are admitted, even if they're not associated with UCSD Health, we do consider them for merit awards as well. So we evaluate your application, your academic background, as well as your professional experience, and then we award a merit fellowship as well. So for those who aren't affiliated with one of these programs, we do have additional funding that is available to those folks as well. So if you're not affiliated, you would be automatically considered in that pool of folks. Additionally, anybody who does have their PhD or MD, we do have an automatic $10,000 that goes to those folks on top of the regular merit award. So that's outside of the agreement with the health sciences because there is such a large award in that sense. But for those who are outside of it, there is that at least automatic $10,000 plus any additional merit funding that we award.
Thank
Great
you.
question.
And then if you don't mind, I could ask another question. It doesn't seem like anybody else has their hand up. The other question is, so you said that you could switch between weekends and weekday classes. Are those classes running concurrently? So are you studying the same thing as the weekend people, or are the weekend people studying the same thing as the weekday people? Because one program's a little bit slower than the other one, so it doesn't seem like it would be possible to toggle back and forth, like if you miss a class to go to the weekend class, or if you missed a weekend class to go to a weekday class.
In the first year, when you're taking the core curriculum, we really need for people to stick with that first choice. So for instance, if you choose the executive program, ideally you would be taking your classes with that cohort. And part of the reason why that's important is you are in group projects with them. I do believe if you happen to miss a class, it's possible to attend the evening version if it works out with the schedule and the professor is in agreement with that. But they also do record classes, so if you miss it, you can catch up. But the idea of actually switching and being able to be more flexible with your schedule, that is really an option once you complete that core curriculum. And once you start, after that and towards the end of the completion, you'll have these prerequisites that allow you to take electives. And it's the electives which, when students take electives, whatever program they're in, they have an option to take them at any time. So the core, you're pretty much with your group. But once you're done with the core, you can take electives that are traditionally offered in the evening, which will most likely have more evening students in them. Or if your schedule allows you to take a class at 8 o'clock in the morning, you're welcome to come and take a class in that kind of the full-time space. But ideally, everyone's mixing up, and we do have quite a few students that flex, as we call it. Does that make sense?
Yes, thank you. And then what are the hours for the evening courses, and which days of the week are they usually?
So the core, all the classes, evening classes are always 6:30 to 9:30. And there is always a dinner beforehand for all flex students, regardless of which class you're attending. So the core curriculum will meet Tuesday, Thursday, 6:30 to 9:30, again, with the dinner in advance to network and hang out with your friends. The electives that are offered in the evening will obviously not be on Tuesday, Thursday. There'll be other nights, Monday, Wednesdays primarily, but it's the same time, and those electives are open to all MBA students. And so you may have your colleagues in there with you, you may have some evening, you may have individuals that are in the flex evening that are on to their, their 2.5 year. So it's a big blend, but it's Tuesday, Thursday for the core. And then, if you stick with that, it's stick in the evenings only. It's basically Monday through Wednesday, or Monday and Wednesday.
Thank you so much.
Sorry, I didn't mention that earlier. That was usually something I talk about, but not tonight. Sorry. So any other questions?
We have one in the chat. I'm seeing, I know you can't see the chat, Christina. So it's that Halia says, thank you for an amazing session. I'm also a Triton grad, go Tritons, with a healthcare background, and would love to know if it's manageable to connect to STEM-based internships if accepted to the full-time MBA program. For the most part, our internships are with our community. So they're not internal to UCSD, so they'd be with a company in the area. And I mean, certainly, I'm sure that there are quite a few internships that would be considered STEM-based, but it would all be up to the organization. And generally, that refers to the academics. The internships are usually employment opportunities that our students get. So not quite sure if I could answer specifically on a STEM-based internship, but there are lots of very, very strong STEM-based academic opportunities here at UCSD Rady.
So we do, many of our employers are, again, from this area, and because the market in San Diego is, I wouldn't say dominated, but it's heavily influenced by STEM-based companies or jobs within the STEM industry. If that's what you wanted to achieve, you'd work directly with your career coach and, set about going, finding an internship in that area from day one. Like, that's the one thing with full-time students. It's easy to get overwhelmed with classes and sort of put that career side on hold. But that's exactly what you can't be doing. In fact, internships, companies start recruiting for interns, as early as August sometimes. But one thing to note about, we didn't mention this in the Rady Fellowship component that Matt had addressed, but if you are a UC grad and you're applying, not through this program, you do also receive an additional $10,000 on top of any merit award that is offered to you.
We love our UCSD alums as well as MDs and PhDs.
UCSD, you at UC. You
UC,
go to any UC.
University of California, yes. In particular, UCSD.
Yeah. Okay. So, gosh. Oh, fun fact. Yeah. Thank you for providing that, there's actually quite a few individuals that have been part of this program. A gentleman who traditionally presents but was unable, his name is Dr. Thomas Hemmen. He is a professor in neuroscience and I think he's a neurosurgeon. In addition, there is a gentleman who's starting his second year. His name is Dr. Eugene Goltz. He is head of lung transplants for UCSD Health. So we have some people that are, I think, fairly respected in their industry, in their fields, and that are, growing and pushing their boundaries both professionally and personally. So it looks like there was a question. Okay, award for scholarship and people having it. Sounds like you said you were automatically given to PhD holders. I'm considering joining the full-time MBA. Is there any support for MDs and full-time MBA? Yes, so the scholarship or the scholarship, the additional funds that are provided to those with PhDs and MDs, they are provided regardless of the program you're looking to attend. It's just an accolade, it's just saying, good job. You spent a lot of time working very, very hard, and we want you in the program, and we respect your background. Okay, well, if there are no more questions, I can put my email in the chat. I think it was on one of the slides, but I probably went through it a little too quickly. So my email is here if you'd like to learn more or set up an appointment. I've heard from some of you already. Have not quite set up an appointment, but I'm just letting you know I'm here. My email address is there, so please feel free to take advantage of it. And if we have no more questions, I'd like to thank you all for coming tonight and enjoy your evening. Thanks.